A stage of development is an age period when certain needs, behaviors, experiences, and capabilities are common and different from other age periods. It is the physical, mental, and emotional stages a child goes through as he or she grows and matures. Some of the developmental stages that we are going to discuss are neonate, infancy, toddler, preschool, school age, adolescent, young adult, and old adult. Specific developmental issues characterize each age group. Infancy is a time from birth to the first 12 to 18 months of life. During this time, the infant is totally dependent on others to meet the basic needs. The toddler period is a time from when a child begins to walk until around 3 years of age. The years between 2 and 3 are significant time for physical and emotional development. Motor development progresses significantly and the child begins to have a degree of physical and emotional independence while still maintaining a close relationship with the primary family unit. Next is preschool period. During the preschool period, generally between ages 3 and 6, a child shows increasing interest and involvement with his age group peers. Most preschoolers are able to relate to their peers and have beginning social interactions with many people. Then we have the school age period, from 6 to 12 years of age. The interest of school age children turn away from their intermediate family to the wider world. The school age child has enough maturity to begin to relate to other people as individuals. After that, we have the adolescence period. Adolescence is characterized by the onset of puberty and is associated with a significant amount of personal exploration. Adolescence ends when the young person demonstrates his or her readiness to assume full financial, emotional, and social independence. In Western societies, this usually occurs between 18 and 21 years of age. During young adulthood, from approximately 21 to 39, individuals focus on selecting an occupation or career, choosing and learning to live with a partner, and starting and raising a family. During middle adulthood, individuals work at establishing themselves in a marriage and mature in their career choice. Most middle-aged adults between ages 40 and 65 begin to face adjustments to physiological changes that occur with maturity. Older adults make adjustments to decreased physical strength, a declining health status, retirement from the workforce, reduced income, decreasing independence, and the deaths of spouse, siblings, friends, and self. To provide effective patient teaching, you must consider the patient's age and developmental level. Knowing your patient's developmental level will help you select the most effective teaching strategies. The 3 developmental areas you'll be assessing are the patient's physical maturation abilities, psychosocial development, and cognitive capacity.
Piaget stages of cognitive development. First, in sensory motor, 0 to 2 years old, coordination of senses with motor responses, sensory curiosity about the world. Language used for demands and cataloging. Object permanence is developed. Pre-operational, 2 to 7 years old, symbolic thinking, use of proper syntax and grammar to express concepts. Imagination and intuition are strong, but complex abstract thoughts are still difficult. Observation is developed. Complete operational, 7 to 11 years old, concept attached to concrete situation. Time, space, and quantity are understood and can be applied, but not as independent concept. Formal operational, 11 years old and older, theoretical, hypothetical, and counterfactual thinking. Abstract logic and reasoning, strategy and planning become possible. Concepts learned in one context can be applied to another.
Stages arise as individuals grow and face new decisions and turning points during childhood, adolescence, and adulthood. Each stage is defined by two opposing psychological tendencies, one positive or synthetic, and one negative or dystonic. As an addition on previous developmental stages, here is an overview of Erikson's psychosocial theory of development. Infancy starts from 0 to 1 year. Conflict, basic trust versus mistrust. Resolution or virtue, hope. Culmination in old age, appreciation of independence and relatedness. Early childhood starts from 1 to 3 years. Conflict, autonomy versus shame. Resolution or virtue, will. Culmination in old age, acceptance of the cycle of life from integration to disintegration. Play age is from 3 to 6 years. Conflict is initiative versus guilt. Resolution or virtue is purpose, and culmination in old age is humor, empathy, and resilience. Next is school age, from 6 to 12 years. Conflict is industry versus inferiority. Resolution or virtue is competence, and culmination in old age is humility, acceptance of the course of one's life, and unfulfilled hopes. Next, adolescence, from 12 to 19 years. Conflict is identity versus conclusion. Resolution or virtue is fidelity. Culmination in old age, sense of complexity in life, merging of sensory, logical, and aesthetic perception. Next, we have early adulthood, from 20 to 25 years. Conflict is intimacy versus isolation. Resolution or virtue is love. Culmination in old age is sense of the complexity of relationship, value of tenderness, and loving freely. Adulthood is from 26 to 24 years. Conflict is creativity versus stagnation. Resolution or virtue is care. Culmination in old age is caritas, caring for others, and agape, or empathy and concern. Last is old age, 65 to death. Conflict is integrity versus despair. Resolution or virtue is wisdom. And culmination in old age is existential identity, a sense of integrity strong enough to withstand physical disintegration.
Now let us start with neonate. This is the first to fourth week after birth. Stage of development. Trust versus mistrust. Trust is the ability to believe in and rely on others. Mistrust may be evidenced as failure to thrive. Next, we have physical. It cannot support a weight of head. Anterior and posterior fontanelles are not yet closed. Then, immature heat regulation. Next, receding jaundice and umbilical stump healing. Then, immature immune system. It still has passive immunity from mother. Lastly, CNS must be stimulated for proper growth and development. Next, we have cognitive or intellectual. Limited cerebral function, not fully established. Behavior is reflexive in nature and learns through sensory stimulation.
In safety, support head and neck when moving or carrying. Protect the fontanelle. Monitor body temperature. Maintain environment. Support head and neck when moving or carrying. Protect the fontanelle. Monitor body temperature. Maintain environment. Wash hands. Avoid exposing to infections. Position on back or side. Avoid use of pillows, thick or tight clothing, or dressings that can constrict the diaphragm. Never leave alone unless in a crib with side rails up and black semi-reclined. Rear-facing position car seat in back seat for child up to 20 pounds or 27 inches. Suspected child abuse, neglect, or unsafe situation must be reported. In psychosocial, development of trust and is dependent on others, bonding with parents or primary caregivers. In fears or stressors, fears are non-evident at this time, but major stressors are physical immaturity. Other stressors might be light, noises, and handling.
General age-specific care. Encourage parents to stay close, promote bonding and participation in care. Limit the number of caregivers. Swaddling increases feeling of security and comfort. Patient education plan. Directed at primary caregiver with emphasis on activity of daily living, preventive care, immunization, nutrition, bonding, exposure to infect, and safety. Assess parents' knowledge of and comfort level in caring for the neonate.
Stage of development. Trust versus mistrust. Trust is ability to believe in and rely on others. Mistrust may be evidenced as failure to thrive. Physical. Obligatory nose breather, poor temperature control and sensitive to fluid loss. Immature immune system, moves from gross motor to fine motor. Can raise head, roll over and bring hand to mouth. Reflexes diminish and intentional actions begin. Can crawl, stand, and even walk alone or with help. Cognitive or intellectual. Learns through sensory stimulation and by imitation. Limited ability to communicate needs or problems. Recognizes and differentiates primary caregiver from others. Mimics sounds and able to put two words together verbally. Manipulates objects in the environment. Psychosocial. Development of trust and dependent on others. Bonding to parents, develops relationships within the family like siblings or grandparents. Begins communication and emotional connection with others. Smiles and repeats actions to elicit response from others like pick a book and pat a cake.
Now let us move on to fears and stressors. Major fears: separation from primary caregiver, unfamiliar situations, and strangers. Stressors: loud noises, bright lights, and sudden environmental changes. Next, parental anxiety may be transmitted to infant. Safety: unable to recognize dangers and should not be left alone. Puts object in mouth, so keep small objects and medicines out of reach. Place on back or side to protect fontanelles and prevent heat loss. Avoid use of pillows, thick bedclothes, or tight clothing dressings that can constrict the diaphragm. Protect from falls, side rails always up, and safety strap on stroller or high chair. Semi-reclined rear-facing position car seat in the back seat for child up to 20 pounds or 27 inches. Lastly, suspected child abuse, neglect, or unsafe situation must be reported. Moving on to the general age-specific care. Encourage parents to stay close. This promotes bonding and participation in care. Limit the number of caregivers in contact with infant. Maintain comfortable environment. This includes soft light, warm, and noise control. Give familiar objects for comfort. Lastly, we have the patient education plan. This is directed at primary caregiver or parents. Emphasis on preventive care, immunizations, nutrition, bonding, and safety.
Let's move on to the toddler stage. Toddler stage range in 1 to 3 years. When we say toddler, it is a young child who is just beginning to walk. The stage of development of a toddler, it is autonomy versus shame and doubt. When we say autonomy, refers to self-control over motor abilities and body functions. Their works to master the physical environment while maintaining self-esteem. The physical of a toddler, it has 4 to 6 teeth, may continuing teething. They eat 3 times a day. They feeds with cup and spoon. They feeds independently by 2 years. They gains 4 to 6 pounds a year. They walks by 15 months. They runs and climbs by 2 years. Packs blocks and scribbles, enjoys our age-appropriate toys. They need 10 to 12 hours of sleep at night and plus daytime nap. They're cognitive and intellectual. They are toilet training. They are parallel with others. They can differentiate familiar people from others. They learn through sensation, exploration, discovery, and imitation. Their thinking is concrete, literal, and egocentric. Their short attention span and limited memory capability, and they also follow the simple commands. And they're psychosocial, they are self-control and willpower, developing sense of independence but remains very dependent on parents for safety, security, and approval. They knows right from wrong, and they are inhibited, energetic, seeks attention, positive reinforcement, and approval. They are impulsive. Their moods is change it quickly. They has little self-control over behavior. And last, they need the security of routine, and it is upset by environmental and activity changes.
Next up, fears or stressors of toddler. Their major fear is separation from parents or caregivers. It may be intense. Next is hospital environment or strangers or procedures may evoke a terror response. And lastly, loss of control and restriction of movement. For their safety, energetic and curious nature may lead to unsafe explorations. Accidents may occur as autonomy increases. Keep side rails up. Chemicals and medications should be kept out of reach. Choking on object is a threat. Forward-facing only car seat for children at least 1 year old and weight of 20 pounds. And lastly, suspected child abuse, neglect, or unsafe situation must be prepared. General age-specific care for toddlers. First, encourage parental presence and participation with care. Next, prepare child for procedures or may use distraction techniques and child life services. Next, offer choices when ones exist. Next, when hospitalized, may have difficulty in sleeping or nightmares. And lastly, speak at eye level with the child and maintain eye contact. Next up, toddler's patient education plan. First, it is directed at primary caregiver or parents of the child immediately before procedures. Next, child safety is an extremely important area to teach parents of the toddlers. Next, young parents may be unaware of safety hazards and may need help in learning ways to child-proof their homes. And next, toilet training also occurs at this age by teaching various ways to toilet train and by continuing to emphasize individual rates of development. Health educators can help parents toilet train their children with realistic expectation and lessen stress. And lastly, give toddler brief, simple, and concrete explanations in words that they can understand. Give one direction at a time and use of play to facilitate learning and to decrease anxiety.
In preschool stage, ages 3 to 5 years. Stage of development, initiative versus guilt. Initiative tasks include exploring, seeking answers, distinguishing between sexes. Needs balance between needs for exploration and necessary limits on behavior. Physical, should grow 4 to 5 pounds and 2 to 3 inches per year. All primary teeth should be present and eats 3 meals a day. Neuromuscular, gross and fine motor skills refined. For example, balance improved, greater muscular strength, jumps in places, walk on tiptoes, stand on one foot, and hops. Able to feed and dress self, bowel bladder patterns established. Now we go to cognitive intellectual, the why stage. Wants to know the cause and purpose of everything. Unable to think abstractly, still concrete, literal, magical, and egocentric thinkers with difficulty differentiating reality from fantasy. short attention span, oriented to the present only, unable to comprehend anticipatory explanations. Psychosocial, able to tolerate brief separation from parents when explanation given. Egocentric, but is increasingly aware of self versus others. Beginning sexual discrimination. Learning to play in groups, imitates adults. Home ritual habits are important. Likes to pretend, ascribes living qualities to inanimate objects. Needs praise encouragement, feels guilty if disappoints parents makes mistakes.
Fear or stressors at the preschool stage. Fear of the unknown, of the dark, of mutilation, bodily injury, or being left alone. Stress and illness may cause regression and separation anxiety. Safety. Preschooler need constant supervision. Accidents and injuries remain a threat due to curiosity and exploration. Keep medications and small objects out of reach. Car seat or booster seat when riding in an automobile. Suspected child abuse, neglect, or unsafe situation must be reported. Specific care for preschoolers. Encourage parental presence and participation with care as much as possible while in a hospital setting. Prepare child for procedures within 5 minutes of procedure. Use distraction techniques, praise, and rewards after procedures. Utilize child life services to assist in explanation of procedures, equipment, and to offer instruction. Offer choices when one exists. When hospitalized, may have difficulty or sleeping or nightmares. Patient education plan for preschool. Directed at primary caregiver and preschooler. Preschooler is very interested in knowing why things are being done to them. Answer questions quickly, honestly, using concrete words they understand, not abstract statements. Use of dolls, puppets, storybook to facilitate learning and decrease anxiety. Honesty is especially important. Teaching topics for parents of preschool children include understanding the importance and role of play, dealing with sexual curiosity, beginning school adjustment, and handling eating and sleeping problems.
School-age children most often have smooth and strong motor skills. However, their coordination, especially eye-hand, endurance, balance, and physical abilities vary. Fine motor skills may also vary widely. These skills can affect a child's ability to write neatly, dress appropriately, and perform certain chores such as making beds or doing dishes. There will be big differences in height, weight, and build among children of this age range. It is important to remember that genetic background as well as nutrition and exercise may affect a child's growth. A sense of body image begins developing around age 6. Sedentary habits in school-age children are linked to a risk for obesity and heart diseases in adults. Children in this age group should get 1 hour of physical activity per day. There can also be a big difference in the age at which children begin to develop secondary sexual characteristics. For girls, secondary sex characteristics include breast development, underarm, and pubic hair growth. For boys, they include growth of underarm, chest, and pubic hair, and also the growth of testicles and penis. Stage of development: industry versus inferiority. Industry equals to interest in developing a sense of self through engaging in tasks and refining skills or doing work. Task mastery involves self-confidence, perseverance, self-control, cooperation, and recognition. Inferiority equals feelings of inadequacy and fears. Physical: seasonal growth spurts in spring and fall. Should gain 5 to 6 pounds per year. Some clumsiness may occur as a result of growth spurts. Baby teeth replaced with permanent teeth increase muscle mass and strength. Neuromuscular skills and balance improve. Despite wide variations, early signs of puberty may appear. Cognitive or intellectual. increased comprehension, thinking is concrete, literal and specific, logical and more deductive reasoning begins, understands cause and effect and solves problems. Functions in present, begins understanding the past and can foresee future consequences, tells time and plans ahead, increased understanding of death and its finality, may be reluctant to ask questions or admit that they don't understand. Psychosocial, same-sex peers more important appear than family, influenced by non-parent adult idols, learns gender-appropriate behavior, attitudes, and roles. Rules are essential to them. Behavior controlled by expectations, regulations, anticipation of praise or blame, begins questioning parental authority, needs praise or encouragement from adults, and wants control over privacy.
Fears and stressors. Great fear of the unknown, pain, bodily injury, mutilation, separation from caregivers and friends, death, loss of control, failure to live up to expectations or disappointing significant others, resent force and dependence and lack of privacy, fuse illness and pain with guilt and or as punishment. Next, safety. Peer pressure may influence child to act with poor judgment, take risks and dares. Safety helmets for biking, skateboarding. Seat belts will replace car and booster seats. Independent behavior may cause ingestion or overdose of available medications. Suspected child abuse, neglect, or unsafe situation must be reported. General age, specific care. Encourage parental presence and participation with care as much as possible. Prepare child for procedures ahead of time. Allow participation in discussions, decision-making, and expression of feelings and fears. Provide privacy. Define and reinforce behavior limits. Offer choices when ones exist. Continue schooling. Next, patient education plan. Directed at primary caregiver and or school-age child. Explain procedures in advance with correct terminology in simple terms. Detailed information enhances the child's sense of control and independence.
Next, let's move on to adolescent or the 13th to 18th year of life. Stage of development. Identity formation versus identity or role confusion. Identity formation is the need to establish a stable sense of self, who they are, where they fit in, where they are going. Tasks include independence from parents to establish their role in society, establishing relationships with members of opposite sex, coping with body changes, development of sexual identity and self-concept. Moving on to the physical aspect, adult weight achieved, rapid changes in terms of height and sexual characteristics. Next, may need more rest and sleep due to rapid growth, permanent teeth, increased body hair and blemishes. Moving on to cognitive or intellectual, increased abilities for logical, abstract, deductive thought, and analytical reasonings, understands hypothetical situations, and forms own opinions. Then, limited understanding of body structures and functions. Next, gains introspection. Then, self-esteem grows internally. Then, development of occupational identity. Doesn't like to ask questions, which makes them appear stupid.
Psychosocial, concerned about how they appear to others, develop sexual identity, relationships with the opposite sex take on new meaning, peer group important, interest in slang words particular to peer group, often question or rebel against authority figures and may criticize parents, unaware of own mortality, feel invisible and that nothing will happen to them. Fears or stressors. Major concerns, appearance, school performance, loss of control, separation, or lack of acceptance from peers, being different. Physical changes associated with illness or injury may be threatening. Safety. Peer pressure may influence to act with poor judgment, takes risks and dares. Use of automobiles, risk of accidents increases for self and others. Suicide is third highest cause of death. Sexually transmitted diseases or STDs and depression is at high level. May experiment with drugs, cigarettes, alcohol, and sexual activity. Any suspected abuse, neglect, or unsafe situation must be reported.
General age-specific care involve adolescent in care with participation in decision-making needs control over events involving them, choice whether parent is present, define and set limits firmly when necessary, offer choices when ones exist, respect privacy and opinions, interview directly may need to separate from parent, continuous
Patient education plan. Inquire if they want parents present during teaching sessions. Use patient's preferred method of education, visual, auditory, or etc. Give scientific explanations using body diagrams, models, or videotapes. Encourage questions and verbalization of feelings. Provide education about cigarettes, alcohol, drugs, and STDs.
Young adult. Young adult range in 19 to 44 years. When we say young adult, it refers to the late adolescence when young people are transitioning out of child. In this stage, they have a greater immunity skills, complete their value frameworks, carry some feelings of invisibility, but they establish their body image. So the stage of development of a young adult, there are intimacy versus isolation. When we say intimacy, it's reaching out and using oneself to form a commitment to an intense, lasting relationship with other person. When we say isolation, it is manifested with poor self-esteem and withdrawal. Their biological maturity is complete. Their brain cells develop peaks. The woman sees most significant changes during pregnancy and lactation. Their cognitive or intellectual, there are a wide range of the life experiences, assist in developing adult intellectual capacities. They reach peak intelligence, memories, and abstract thoughts. They form their own opinions and makes independent decisions. They choose vocation, receives appropriate education, and their psychosocial, they are solving issues from adolescence, establish personal identity, values, attitudes, interests, and acceptance of self. They develop adult roles and responsibilities at work, home, and society. They come to terms with sexuality and preferences. They develop and maintain friendships and intimate love relationships. Their fear and stressors, their loss of independence, the loss of job due to illness or injury, the separation from spouse or significant others, children and friends, their balancing roles of career, marriage, and child rearing simultaneously. Their challenges are managing growing number of responsibilities at home, work, school, or community. And their safety is major cause of death and is related to accidents, suicide, and homicides. Their seatbelt use in automobiles, stress and depression may be experienced. STD is a risk due to experimentation with various lifestyles. Encourage condoms, and they promote recreational and personal safety habits. And they are lastly, their suspected domestic violence, abuse, or unsafe situation must be reported.
General age-specific care for young adult. First, they should receive at least one thorough health assessment yearly. For example, screen for STDs, hypertension, and cholesterol levels. Next, smoking cessation, counseling or program if applicable. Next, treat with respect, encourage decision-making and self-care. Next, don't be judgmental, support decisions you may not make. Next, involve the individual with plan of care and decision-making. Next, explore the impact of a hospitalization or illness on work, job, family, and other commitments. And lastly, never use terms of endearment, like for example, honey, sweet, sweetie, or darling. Next is patient education plan of young adult. First, include significant other in education. And lastly, use patient-preferred method of education. For example, visual, auditory, etc. Next up, middle adult. Stage of development of middle adult. First, generativity versus stagnation. Generativity, concern about providing for others that is equal to concern about providing for oneself, guiding the next generation, or contributing to humanity. Stagnation, which is self-absorption. Next is physical. Slowing of physiologic functions and possibility of chronic health issues. Increased height, muscle mass, tone, subcutaneous fat, near vision, nerve conduction, ability to hear high-pitched sounds, skin begins to dry, the inability for tissue regeneration, decreased bone density and strength, and lastly, atrophy of the reproductive system, hormone production decreases, or for women, menopause.
Cognitive or intellectual development for middle adult. Time of maximum command of self and influence over others. Forms own opinions, make numerous decisions, and may hold highest status job. Life experiences provide continued learning, reflects on and reassesses life, and understands reality of death. Psychosocial. Sandwich generation is the concurrent responsibilities for children and aging parents, especially for women, are maintaining contact with but letting go of parental authority over children, or meeting needs of aging parents, or additional support may be needed. Achieving financial and emotional security. Finding new sources of satisfaction. Preparing for retirement. Fear or stressors for middle adult. Loss of control and values important to the family. Dependency on others. Loss of youth, vitality, and sexual appeal. Work and social status, or disenchantment with work. Heavy financial responsibilities or make major life decisions. Balancing roles and responsibilities of career, family, and friends. Loneliness as children leave home, or caregiver role for elderly parents. Menopause for women. Death or death of spouse. For safety, middle adults are at risk for heart attack, stroke, and fractures. Suspected domestic violence, abuse, or unsafe situation must be reported. Specific care for middle adult. Respect their decisions, allow as much control over their care as possible. Never use terms of endearment such as honey, sweetie, or darling. Allow verbalizations of fears and concerns. Need regular physicals and healthcare screenings. Involve the significant other with plan of care. Provide privacy and provide for mobility and functional needs. Patient education plan, specifically for middle adults. Include significant other and family in education. Use patient's preferred method of education, such as visual, auditory, etc. Cardiovascular health, such as weight-bearing exercises.
Older adult, stage of development, ego integrity versus despair. Ego integrity equals accepts life and self as they are. Despair equals to rumors about what could have been. Physical: diminished function, muscle atrophy, brittle bones, stiff joints, fragile or dry skin. Cardiovascular: low cardiac force, cardiac output, and arterial elasticity. Lungs are more rigid, low oxygen exchange. Loss of teeth, low ability to fight infection, low sensory function and balance, sleep pattern irregularity. Cognitive or intellectual: performs cognitive tasks more slowly due to low visual, auditory, and tactile acuity or slower motor responses to sensory stimuli or short-term memory losses. Needs time to process information and link events. Intellectual ability tends to decline depending on use.
Psychosocial: coping with adjustment necessitated by advanced age, illness, and disability. Reviews life's accomplishments and deals with loss. Confronts their own mortality and death of spouse, friends, and associates. Fears and stressors: loss or death of spouse, adult, children, and friends. Declining mental and physical health, social isolation, diminished self-relevance of values important to family. Loss of independence or increased dependency on others. Safety: injury risk due to physical and cognitive impairments, may be unable to recognize dangers, increased risk for falls. Unfamiliar environment and presence of strangers may cause confusion and or agitation and falls. Suspected elder as abuse, neglect, or unsafe situation must be reported.
General age, specific care. Preserve dignity and autonomy as much as possible. Involve family with plan of care. Encourage reminiscence and validating concerns. May require reorientation to environment, time, and day. Injury prevention precautions like fall prevention, skin integrity maintenance. May require increased use of assistive devices like canes, walkers, wheelchairs. Never use terms of endearment like honey, sweetie, darling. Provide adequate lighting and ensure adequate warmth due to low heat regulation. Next, patient education plan. May require longer time to learn. Ensure use communication aids like hearing aid, eyeglasses. Face patient, speak slowly and distinctly. Do not shout. Include significant other family members in education and decision making. Allow verbalization of fears and concerns.
Next, we have old age. Stage of development: ego integrity versus despair. Ego integrity is equals to accepts life and self as they are. Despair is equals to remorse about what could have been. Physical: diminished function, muscle atrophy, brittle bones, stiff joints, fragile or dry skin. Cardiovascular: decreased cardiac force, cardiac output, and arterial elasticity. Lungs more rigid, decreased oxygen exchange, loss of teeth, decreased ability to fight infection, decreased sensory function and balance, and sleep pattern irregularity. Cognitive or intellectual: performs cognitive tasks more slowly due to decreased visual, auditory, and tactile acuity or slower motor responses to sensory stimuli or short-term memory losses. Needs time to process information and link events. Intellectual ability tends to decline depending on use.
Psychosocial, coping with adjustments necessitated by advanced age, illness, disability. Reviews life's accomplishments and deals with loss. Confronts their own mortality and that of spouse, friends, and associates. Fears and stressors: loss or death of spouse, adult children, and friends. Declining mental and physical health, social isolation. Diminish self-relevance of values important to family. Loss of independence or increased dependency on others. Safety: higher injury risk due to physical and cognitive impairments, may be unable to recognize dangers, increased risk for falls. Unfamiliar environment and presence of strangers may cause confusion and/or agitation and falls. Suspected elder abuse, neglect, or unsafe situations must be reported.
Now let's move on to general age-specific care. First, preserve dignity and autonomy as much as possible. Involve family with plan of care. Then, encourage reminiscence and validating concerns. Next, may require reorientation to environment, time, and day. Then, injury prevention precautions, fall prevention, skin integrity maintenance. Then, may require increased use of assistive devices, which includes canes, walkers, and wheelchairs. Never use terms of endearment like honey, sweetie, and darling. Next, provide adequate lighting and ensure adequate warmth due to decreased heat regulation. Moving on, we have the patient education plan. May require longer time to learn and ensure use of communicating aids such as hearing aid and eyeglasses. Next, face patient and speak slowly and distinctly. Do not shout. Then, include significant other, family members in education and decision making. Then, allow verbalization of fears and concerns.
Summary points. In order to plan and implement individualized approaches to health teaching, the nurse must take age and developmental level into account. When working with children, you must assess cognitive and psychosocial development. This will influence the level of teaching strategies chosen and help identify whether parental or peer involvement would facilitate learning. If psychomotor skills are part of learning need, you must determine whether the child has enough physical maturation to realistically perform the skill.
When assessing an adult, emphasis on the developmental stages is different than when assessing a child. The average adult possesses cognitive capacities to learn, so assessing the precise level of cognition becomes less important. It is important to assess current knowledge about the content area. Assess physical skills by focusing on past experience with skills and the adult feelings about manipulative competencies. This helps to determine the amount and type of practice that will be needed to master psychomotor skills.
As we continue, assessment of older adults needs to focus on the physical experiences by a given individual. Psychosocial assessment is also important in working with adult age groups. In working with the elderly patient, you may feel overwhelmed with trying to teach a patient and family when the frail elderly person may have multiple medical problems and more than 10 medications, and is dependent in the several activities of daily living. Yet these patients and families need the most education and support you can give or provide. Through careful assessment of developmental factors, selection of teaching strategies that are age appropriate, and compensations where needed to overcome normal deficits seen with aging, you can plan and implement effective patient teaching.